Is the swelling in your leg after your knee replacement that's hanging around, is this normal?
SOA. Swelling of the ankle.
Oh, swelling.
That's my abbreviation in my notes.
Oh, nice.
SOA.
Okay, welcome to Talking with Docs. I'm Dr. Brad Wiening.
I'm Dr. Paul Zalzal.
And today we're going to talk about the swelling that obligatorily happens in your leg after you've had a hip or knee replacement or even a broken bone in your lower extremity, what the timeline looks like, and what you can do to reduce that amount of swelling, because this is important.
Okay, and distinguish too, if you are experiencing swelling of your leg, usually it's on the affected side.
Okay.
Okay, if you're having swelling of your legs on both sides.
That's not because of the surgery?
That could be, it could be because of the surgery indirectly if you're having some heart problems, right?
Right.
You're not pumping the blood enough to get that fluid out.
Right.
So be careful if you have swelling in both legs. We're talking about the swelling that happens in the affected side after any trauma. It doesn't even have to be a broken bone, like a bad sprain or ligamentous injury to the knee. Will give you swelling of that leg and certainly a total knee replacement.
And you're saying the causes of both legs are kind of heart failure, kidney failure, fluid retention, that kind of stuff.
Yeah, exactly. That's something more systemic as opposed to anatomic as a result of the local trauma.
Okay, and as normal as we say it is there ever a situation where you have one leg that's really swollen after surgery where you should be a little more nervous about it and not write it off as the normal process?
Sure, if it's the other leg, that's concerning, DVT, or if it's associated with a lot of pain in the back of the calf, then I worry about a DVT. That's
What's a DVT?
Deep vein thrombosis.
Deep vein
I think
thrombosis.
we've had another video on that. And of course things like chest pain, shortness of breath, tachycardia, fast heart rate. Those are signs that, maybe there is a blood clot going on.
Which is why you're probably on a blood thinner for a period after your knee replacement.
So it is important to get that swelling checked out.
Yeah.
However, we're talking about this.
Oh no, there's one more. Another situation is if it's really red.
Right.
So if it's really red and you're worried about a superficial infection, something called cellulitis, we have a video on this as well. These are things that you should probably talk to your doctor or to your surgeon about just to make sure that it's nothing more serious. We're talking about the run-of-the-mill, thick swollen leg that's bugging you. It kind of is achy. It's preventing you from getting your full range of motion, which is really the main goal.
Yeah, and you know it's not a blood clot. You know it's not an infection.
Right.
So now we're talking about just a swelling.
How long does this stay around normally?
I tell my patients it can take up to 6 months to go away.
6 months.
But the majority of it goes away around 9 weeks to 3 months.
Right.
But it can stick around longer than you think.
Yeah, in the first couple of weeks, it's really swollen. You're like, whoa, my leg is so swollen. And imagine trying to bend a sausage casing that's really, really full. I always tell people, if we can reduce that fluid, it just allows you to bend that leg easier, which is one of the critical motions to recovery after a knee replacement.
You can all relate to bending a full sausage casing.
Yeah. Yes. Okay. So there's 5 main ways that have been studied with actually well done randomized controlled trials to prove or increase your ability to reduce the swelling and give you a better outcome. So let's start at the beginning. What is number one way to reduce the amount of swelling in your leg?
Physics. It's just physics. Compression.
Okay.
Right? Apply some kind of compression. It's usually a compression stocking or a tensor bandage or something like that.
Okay.
Some kind of compression to compress the tissues to help get the fluid out of those tissues.
You know who does not love compression stockings?
Just about everybody?
People that have to wear them. So a compression stocking usually has 20 to 30 millimeters of mercury of pressure. There are different over-the-counter ones that are not quite as strong, or your doctor may recommend stronger ones if you have insufficient veins or other pathology, but they're quite tight by design. And they're quite hard to get on. Often patients will joke that them and their spouse, their partner, or their friend are battling. It's like wrestling with the compression stocking. Once you get them on, you actually feel a lot better. And we've done videos with Dr. Chan, one of our vascular surgeons, to the point where I actually wear them all the time now when I'm at work.
Okay, Pippi Longstockings.
Well, the short stockings, but
for sharing.
Yeah, so they're really, really important and can make a really big difference, improving your swelling by even 25 to 33% in some of the randomized controlled trials. So number 1, compression, just makes sense.
It's obvious.
Okay, number 2 is cryotherapy. Not crying because your knee hurts so much, but cryo with cold therapy. So this can be a combination of ice packs or continuous compression units. And now I'd say the continuous compression therapy or cold therapy, is becoming much more common, almost the standard of care, and it makes a significant difference compared to just ice alone or ice packs alone, but both of them reduce your swelling, again, in that 1/4 to 1/3 range with good evidence.
All right. So the next one is lymphatic drainage. Okay. So some kind of manipulation from a third party, a physiotherapist, massage therapist, something like that, doing some sort of lymphatic drainage.
Right.
This one has been shown to be beneficial as well.
Yep.
Can reduce it by about 20 to 30%.
Right. It's a little more kind of labor intensive, right? So someone is literally kind of milking that fluid back to your heart, because we all have lymph fluid that kind of lives outside of our vessels. What this does helps get it back into the vascular system, back to your heart to reduce the swelling in your lower legs. But yeah, studies have shown 20 to 30% reduction in swelling, usually 2 or 3 times a week for that first week and then once a week after that.
And I would say be careful with this one. Please do not have that person who is applying the lymphatic drainage go near the incision.
Right.
If you've had a total knee replacement or total hip replacement, stay away from the incision. Don't let anyone do any sort of manipulation near that. I say for 6 months. Okay. Just stay away from that incision, because I have had a situation where someone went at it and went at it and went at it, and the wound opened up.
Oh my.
So, it happens. So just do not let anyone near those incisions except for your surgeon or your healthcare provider who's going to be removing the clip.
Yeah, it's mostly the calf is where the issue is. You got to milk it back there.
Yeah.
Okay. Number 4 is exercise and early mobilization. So what's different, I'd say, in the last 20 years, people used to sit around in bed a lot after knee replacement and really just focus on their pain. Maybe they do a little bit of gentle range of motion in bed, but now we're getting people up right away. We're getting them up after surgery in the day surgery unit, because most of them are going home the same day now. So people are walking and moving really quickly. Why does that make a difference, Paul?
The action of moving around engages those valves in your veins. Your veins are there to pump the blood out of your periphery, okay? And they have little valves in them, but they don't work if you're just lying around. Certainly if you lie and elevate, gravity will help do that. But in the absence of elevation, just sitting there with your feet down, it's going to pool. But if you move around, that'll help the muscles squeeze the veins and act as little pumps to get the fluid out of there.
Right.
Moving around is good.
And the same as when you're wearing like one of those air cast boots for a broken bone. Because your calf doesn't pump, you're kind of rolling through that rocker and kind of stomping on it. That's why your foot swells in those situations too. You don't have that active musculature pumping that stuff one way back to your heart.
Yeah.
Okay, so number 5 requires an asterisk.
This one I don't really prescribe. It's medication. There's medications that are used. And I mean, if you go to your doctor in the absence of any trauma or surgery and you have swelling of both your ankles, certainly you will likely get prescribed some kind of medication to reduce that fluid overload in your body to give your heart a chance to catch up.
Right.
And there's lots of diuretics and different medications that help you basically pee out all that extra fluid. However, that's one of the ways to treat swelling after surgery.
Yes.
I don't prescribe that. I don't recommend it.
And the main reason is because of potential electrolyte abnormalities, because salt is one of the main drawers of water back into our body. So if it gets rid of your salt, it can upset your electrolyte imbalance, can also make you dehydrated. So even though you have lots of fluid in your legs, you might not have a lot of fluid in your blood system. So you have to be very, very careful with these. Definitely not routinely prescribed.
Yeah, so they are routinely prescribed for people who have congestive heart failure or other reasons for swelling in both their ankles. However, not routinely used for the specific situation of swelling in a limb after trauma or surgery.
Okay, so to summarize, your top 4 are compression therapy, usually with compression stockings, cryotherapy with an ice compression, cold compression unit, or just ice packs, lymphatic drainage, actively getting someone to milk that stuff back to your heart.
But stay away from the wound.
Stay away from the wound, as well as exercise and early mobilization. Now you have an approach how to deal with your swelling to increase your chances of being success after your knee. I'd say it applies to hip replacement as well.
Sure it does.
Or even some of your lower extremity fractures.
Trauma.
Or trauma. If you like this video, please like it, subscribe to our channel.
And remember, you are in charge of your own health.
We'll see you next time.